Hi there. Please keep in mind this podcast is for informational and educational purposes only. The information and education provided are not intended or implied to supplement or replace professional medical treatment, advice, and/or diagnosis. Hi, welcome back to my podcast. Thank you for being here. My name is Ashley. I'm a registered dietitian, and I love to dive into nutrition hot topics. So today I want to cover GLP-1 agonist medications. A popular one you may have heard of is Ozempic, right? And I want to go over, are these magic pills or overhyped products? Basically, do they deserve the bad rap or the hype? And we'll get into the science behind these medications a little bit, and then we'll go into some myths and misconceptions. Please note, I am not a physician. I am not a pharmacist. So if you need to decide whether these medications are right for you, please consult with your medical provider to help you make that decision and to help with getting the medication, to help with the prescription. I, as a registered dietitian, cannot prescribe GLP-1s. However, I do have patients and clients who have taken a GLP-1 medication. And so I do have some experience with helping people navigate this process. You may want to also know what my perspective is as a registered dietitian, since I'm in a field that often helps people with weight management. And so being that I do have patients who've been interested in these GLP-1 agonist medications, I do have some strong perspectives as to whether or not I believe they're, a miracle drug versus an overhyped product. I would say that most clinicians, like with most things, will say it depends. But I'll dive deeper into that in a second. So why do we want to know about GLP-1 medications? Well, it's garnered a lot of attention and a lot of demands, particularly in the past year and a half or so, due to its quick weight loss effects. Now, Ozempic is a type of GLP-1 agonist medication. Ozempic itself has been FDA approved for the treatment of diabetes. However, the FDA has approved GLP-1 agonist medications for the treatment of overweight and obesity. So that means that these medications are not just for people with diabetes necessarily. Semaglutide is the generic name of a specific type of GLP-1 agonist medication. So Ozempic is the brand name for semaglutide that's indicated for use in people with diabetes. However, semaglutide also comes under another brand name called Wegovy, and that's indicated for use in folks with overweight or obesity. And so it's important to make that distinction because, yes, it's true, Ozempic is for folks with diabetes, but there is a quote unquote weight loss drug out there for people who are clinically indicated for weight loss. So there are multiple reasons why someone might need to be on a GLP-1. We're also finding through lots of research that there are other conditions for which GLP-1 medications are helpful. So anywhere from heart disease. I just got a notification that the FDA approved semaglutide for the treatment of kidney disease. We're also finding that the medication is not only helpful for reducing food cravings, but it could also reduce other cravings, such as the craving for alcohol or shopping, and treating those types of disorders. So I'll step it back a little bit, right? Like, what does GLP-1 mean? GLP-1 stands for glucagon-like peptide 1, which is a hormone that our body naturally makes. It helps with regulating our blood sugar and our appetite. Now, GLP-1 agonist medications are also known as incretin mimetics because they mimic the effects of GLP-1 hormone in our body. So for that reason, it helps with slowing gastric emptying, which helps us feel full for longer. It helps with reducing our appetite and insulin sensitivity. So it helps with blood glucose control. For this reason, it was initially indicated for the treatment of diabetes, but after more research and more anecdotal evidence even has surfaced that folks who were taking these medications for the indication of diabetes also saw clinically significant weight loss, that kind of sparked more research into determining whether this medication would be effective for use in folks who don't have diabetes, but would benefit from weight loss. So after many clinical trials with positive results, the FDA in 2021 approved Wegovy for the treatment of overweight or obesity. And so it is an FDA approved drug for weight loss, even if someone does not have diabetes. Now, there are other eligibility criteria to consider, but that is an important distinction to make, that this is not just a diabetes drug. And I don't know how many times I want to repeat that, but I feel like that is a common myth, and we'll get into that a little bit more. But I think that myth kind of fuels a lot of stigma. So I want to make that clear. Now, what are these studies? What does clinically significant weight loss even mean? Well, there was a double-blind, placebo-controlled large clinical trial that was published in the New England Journal of Medicine that showed that participants who were taking semaglutide for weight loss lost an impressive 15% of their weight approximately on average. Now, one thing to note that even in that study, those participants were expected to follow a diet and exercise regimen. And diet and exercise has been considered an adjunctive therapy to GLP-1 agonist medications. What does that mean? That means that when someone is prescribed a GLP-1 agonist medication, they're expected to also engage in diet and exercise lifestyle changes, right? It's not an and or, it's a both. Does everyone necessarily follow that guideline? Probably not, but it is, I think, key or critical to understand, because often another myth or misconception is that people who are taking these medications are lazy. They think it's the easy way out, but for many reasons, like diet and exercise are not excluded from their lifestyle just because they're on these medications. Like, they're not prohibited to engage in exercise or to start a new optimal diet for their health just because they're on these medications. They really should be doing it all for the best effects, and also just for being able to potentially transition off from the medications, which I may make this like a separate topic, like what life after GLP-1s, like we can make that a separate topic. Drop a note or a comment if you think that would be interesting to cover, because that's a whole nother consideration and a whole nother world and a whole other type of patient, right? Patient who's actively taking a weight loss drug has a very unique experience from someone who stopped taking a weight loss drug, right? Now, that's not the scientific way of talking about a GLP-1 agonist medication. Like, I know my pharmacists out there are probably like, don't call it weight loss drug, but for the purposes of this podcast and for the purposes of just being able to follow all of this information, like, I'm calling it that. So what next, right? Like, if someone is interested in taking a GLP-1 medication, they go to their doctor, they get prescribed the medication, they're deemed clinically eligible for it. What next? And I do want to say that eligibility matters. So, there always are going to be folks who try to get this medication off label, and that's not great, and so prescribers have a responsibility to confirm clinical eligibility before they prescribe a medication. So someone who does not have overweight or obesity, who does not have diabetes, should not be prescribed a GLP-1 agonist medication. Like, I don't need to be a physician to know those basic criteria, right? Even from my perspective as an RD, as a registered dietitian, like, I'm not going to promote a weight loss diet, so to speak. If it's not healthy for someone to lose weight, given their unique circumstance, I'm not going to promote a weight loss diet. And so similarly, if someone does not have overweight or obesity and does not have diabetes, the ethical thing to do as a prescriber is to deny them that prescription for a GLP-1 agonist medication. That doesn't always happen. We know there are loopholes, but that is something to keep in mind, that not everyone is clinically eligible for this type of drug. But those who are and who move forward with taking it have unique needs and interest. And that is something that as a provider, I always want to be sensitive about. Or sensitive to. How do we really move forward from here, right? Like, I think if you're someone who wants to take this medication, your doctor prescribes it, you fill the medication, you start taking it, or even before you start actually taking it, one thing you might want to consider are what are the benefits and what are the risks? Now, any medication is going to come with benefits and risks. So it's just about what is your risk tolerance, right? So the benefits of GLP-1 agonist medications, we know that folks can lose an average of 10 to 20% of their body weight, depending on the medication and the dosage. People taking these medications also see improvement in metabolic markers, such as reduced A1C. So someone with diabetes may be particularly interested in following their A1C over time, and this medication can help them reach their target A1C levels. It can also help with improving cholesterol and lowering blood pressure. And like I mentioned before, researchers are finding that GLP-1 agonist medications are helpful for so much more besides the treatment of diabetes and overweight and obesity. We're finding that it may be helpful for the treatment of heart disease, with addictions. And I just received a notification, I mentioned this earlier, that a certain type of GLP-1 agonist medication is also approved now for the treatment of kidney disease. So it really has broad and robust effects. And that's part of the reason why it's so hyped up, right? People are very enthusiastic, and it's understandable why. If you're battling a chronic medical condition and, you're at your wit's end, having a drug that's this effective that can cover multiple conditions, and people who have overweight or obesity are at risk for multiple chronic health conditions. And so if they're able to mitigate their risk by taking this medication and reduce it specifically, that can be life-changing. Now, again, there are risks and side effects. So a common side effect, or a common group of side effects that I see as a provider for my patients and clients who are on these medications, is that they experience nausea, vomiting, diarrhea, and constipation, which is usually dose dependent, and it can be temporary. That is really dependent on the individual. But rarer side effects that you may have seen in various media headlines are things like pancreatitis, gallbladder issues, thyroid tumors. But I believe that for some of those conditions, particularly for the thyroid tumors, there are no clear links in human studies yet. A lot of these are based on animal studies. So that is also something to keep in mind. These medications are not recommended for everyone, right? And I already went over that there are certain clinical eligibility criteria to keep in mind. And so, for instance, it's not recommended for people with a history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2. So that is something that your medical provider would have to assess at the time of, prescribing this medication. Now, we can go into myths and misconceptions a little bit more. So I started this segment talking about, are GLP-1s a magic pill? And I'm going to go ahead and say false. They're tools. They're not standalone solutions. So I will probably say this a bunch more times, but diet and exercise remain essential for long-term success as adjunct treatment. So if you are taking a GLP-1s, it is best and actually recommended that you're also following an optimal diet and exercise regimen. It is not mutually exclusive. So just because you're taking GLP-1 meds doesn't mean that diet and exercise should fall by the wayside. Those are all things that are important for your overall health. Honestly, whether you're on a GLP-1 agonist med or not, diet and physical activity are important. We all know that. I don't emphasize that too much, but you want to make sure that you're doing things that are promoting long-term health versus, just focusing on diet and exercise when you're frustrated or when, or have a big event or something like that. This is really meant to be like a lifestyle commitment. And when you're taking GLP-1 meds, it's even more important because one thing that we know is that when you lose a lot of weight quickly, so like with these GLP-1 meds, I don't know if I mentioned the large placebo-controlled trial where that was published in the New England Journal of Medicine, where a lot of participants on average lost, 15% of their weight. It's considered clinically significant because even just 5% weight loss is clinically significant. So 15% is threefold that and very impressive. So when people are losing that much weight and that quickly, also time frame matters, right? It's like 5% in what time frame? 5% over 2 years, for instance, wouldn't necessarily be clinically significant, but like 5% of your weight loss in 2 weeks or 1 month, that's considered clinically significant. 15% over 6 months or a year is clinically significant for sure. So is one of the draws of this medication is the quick weight loss effects. And so with that, whenever you lose that much weight quickly, what can happen is you're also susceptible to losing a lot of muscle mass. So how do we mitigate that, right? Like you are prescribed this GLP-1 medication for the purpose of weight loss. You can benefit from weight loss. You're losing the weight, you're losing it rapidly, but you're also losing muscle mass. What do we do? So and this is another reason why diet and exercise are so important, because one thing that you want to focus on in that scenario is resistance training. You want to make sure that you are preserving as much of your muscle mass as possible. And by preserving your muscle mass, you're also preserving bone mass. And so I think I just saw like a viral TikTok or something about this woman who was on a GLP-1 agonist medication, and she was on it for a year. She stopped it. And then she was sobbing because she said she wasn't expecting to lose so much bone mass. And after a visit to her doctor's office, it was revealed that she has osteoporosis, and she was relatively young. I don't know her exact age, but she looked younger than 40. So she was very cheerful about that, and it's gone viral. There are a lot of critiques in the, clinical space about whether or not she should have been on that medication in the first place, because it seems at baseline she did not have overweight or obesity. Unclear whether or not she had diabetes, but there are other drugs to treat diabetes. So that was one. And two, that's why so many of us emphasize that diet and exercise is supposed to be an adjunctive therapy. They're essential for folks taking GLP-1 meds, because if you're not doing anything to try to retain your muscle and you're losing all this weight quickly, that's a natural effect of quick weight loss. You're going to lose muscle, and over the long term, over a year, that might start having effects on your bone mass. So it is critical for your long-term health to commit to diet and exercise when you're taking a GLP-1. Another misconception people have is that these medications are not safe for long-term use. Now, GLP-1 medications have actually been around for a while, like many years. Again, they were initially approved for the treatment of diabetes, and people with diabetes have been taking it for a long time. So we do have long-term data on GLP-1s. What we don't necessarily have long-term data on is GLP-1s for the specific use in a population of folks who have overweight or obesity, but have not been diagnosed with diabetes. So that's something that is an important distinction, because yes, we don't have long-term data for these meds for the specific use of promoting weight loss, but we do have long-term data in terms of its use in folks with diabetes. So we know that it's safe, but long-term studies are ongoing, and, we just have to keep following the science. And if you do have any anxiety around it, I would talk to your doctor about alternatives, right? Like, I think it's completely natural to be concerned about starting a new medication. especially one that has such robust effects. Like, I understand those anxieties. Like, I don't want any one of my patients to feel gaslit because they have these concerns. I feel like often I hear of clinicians being like, of course they're safe. Like, why wouldn't you take it? You clearly need it, like type of thing. And the patient's like concern is not being heard. And so, yes, we know that it's safe, let's say, for the indication of diabetes, and there's long-term data there, but the research is still ongoing, and it is a big decision to make. It's a big personal decision to take any medication, particularly one as, hyped up as a GLP-1 med. So I get it, but I wouldn't say that they're categorically unsafe. So that in of itself is false, but I do think that it's valid to have concerns. Now, another thing I hear a lot is weight will always return after stopping. Again, I think this should be a whole different podcast topic, life after taking GLP-1s. Data actually shows that if you stop taking a GLP-1 medication, you're most likely going to gain the weight back. Will you gain all of it back? That is largely dependent on your lifestyle habits, right? So that's where, again, diet and exercise really come into play. If you are not following any sort of diet and exercise regimen, you kind of revert to some older habits and then you stop a GLP-1 medication, you're going to gain a considerable amount of weight. Like, that's almost certain. It's kind of like taking medication for any condition. Like, if you have diabetes and you're insulin dependent and you stop taking your insulin, like, your blood glucose control will become poor. Like, it won't be well regulated. So that's with any chronic condition. You stop the treatment, you're going to see some negative impact there. That being said, in the case of GLP-1 meds, you don't have to gain all the weight back, right? And hopefully you don't. And one way to mitigate that is by having a solid diet and exercise regimen that works for you. Some people may ask, so what's the best one? That is very dependent on who you are. It has to be personalized. I'm not going to be like, oh, keto or, some other type of diet is what's going to, keep the weight at bay. It really depends on your specific circumstance. So, and that itself will be another podcast episode, like, what's the best diet? Because there is not one best diet for everyone. It really depends. Some things to consider too with these medications is that not everyone stops the medication because they want to. The reality is that GLP-1 meds are really expensive. And so not everyone can stay on these medications forever. Even if they have the chronic condition, right? They have obesity, they're taking this med, then their insurance company is like, we're not covering it anymore. Or maybe they lose insurance coverage. These meds can be I think $1,000 a month or something like that without coverage. So some people simply can't afford to be on them forever. They are stopping them not because they want to, but because they have to. Like, they don't have any other ways of accessing it. And so that is why, life after GLP-1s can be so complex, because not everyone is like, okay, I'm going to try this medication for a little bit and then stop. A lot of people are like, I was committed to taking this medication for much longer, but didn't have access to it for very long. So that is something that I think is real. It's what's happening to so many folks. And, it doesn't mean that they have to go back to their baseline weight, but it does mean that it's going to take a lot of resolve to maintain their weight loss, to, keep the progress, because they're dealing with both the physical need to engage in like diet and exercise and like lifestyle changes, but also like the emotional aspect of, dealing with being kicked off of a med. And that's not easy. So these are all things that I talk to lots of folks about, like with other clinicians, with my patients. And I just think it's really fascinating that this drug is out there. From my perspective as a registered dietitian, before someone starts a GLP-1 medication, I like to discuss their goals, like review their medical history, see whether or not they understand the potential risk and benefits. One thing that I have noticed is that so many people aren't told by their prescriber like what to expect. They're told like, okay, you're going to lose the weight. Maybe you'll feel a little nauseous, but they're not told like, oh, by the way, like if you aren't doing enough strength training, you might lose considerable amount of muscle mass. Also, like not a lot of people are able to stay on these medication long term because insurance doesn't always cover it. Like they're not told these things. So what I find on both ends of the spectrum, like when I talk to other providers, like physicians, not all prescribers are really setting expectations with their patients. So when people say like, oh my God, I stopped the med and I gained a bunch of weight, I have found that some clinicians are like, duh, like, why would you expect to keep it off after stopping a weight loss medication? And they don't realize that these people were not set up for success. Like they weren't really like in a position where their provider would explain all of this to them in clear and concise ways so that they understood what would happen during the course of their treatment, but also after the treatment. And so that's something that if I have a client or a patient who's about to start a GLP-1 med, I like to see whether or not they have had their expectations set. Like, are there realistic expectations surrounding weight loss and the timeline of that weight loss, but also of medication use? And so once they start taking a GLP-1, I like to focus on, making sure they are following a diet that's optimal for them and they're getting adequate protein according to their needs. And also that's going to change as they lose weight. When they are taught how to eat mindfully while they're on the medication, it's easier to implement those mindfulness techniques when they're off the medication. There are strategies to help mitigate some of these side effects. So in general, we talked about the benefits and the limitations of GLP-1 meds. There are risks, right? But there are also really impressive benefits. And at the end of the day, we need to understand that this medication is life-changing for so many people, particularly people who are actually clinically eligible for it. And so I think that we need to challenge the stigma around these meds, and so that people don't feel ashamed about doing something that is right for them and that's going to help them achieve optimal health. That being said, there are folks who are taking advantage of the system and leveraging their resources and their access and are not clinically eligible for these meds and are somehow getting prescribed them. And I don't think that's ethical, and it also can be harmful, right? Because there are risks to taking these meds. So if you're not clinically eligible, I believe the risks are even greater. So that's an important consideration as well. And so if you want to learn more about this topic, maybe I'll dedicate another podcast to GLP-1 meds 2.0. You can also go to different organizations that are doing a lot of research and work around this. So the American Diabetes Association, the Obesity Society, those are organizations that you can look into. But in general, please let me know if you want more of this, and I'll be back next week to talk more about that. I also want to talk about some of the ways that we can support weight management as dietitians, regardless of if someone is on a weight loss drug, and kind of all the different strategies there. But if you want something personalized to you and your needs, book a call with me, sign up for a one-to-one session. I'll drop those details below. And if you have any other ideas that you want me to explore, please let me know. Thank you so much for being here. I appreciate you.